I think they just the call it sing, but I end up in Jolly's pharmacy. And down in the street, Jolly's fix up my immune system. Me feeling fit and strong now, I'm ready to work and pick on any mission. If you see me again, Jolly's pharmacy is number one, Jolly's working. We cater for everyone, Jolly's working. Boost up your immune system, Jolly's working. Yeah. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Good morning, good morning, good morning. And it is another beautiful Wednesday morning. And of course, as usual, we are here with you on Jolly's Health Vibes right here on the big station, Q95 FM. Good morning, of course, to all our listeners who always look forward to health vibes. This morning, it's me, Trudy, in studio with you. And with me, Justin Fafig and Defo, who, of course, pops in once in a while. We don't have the chief host in the house. Carlton Lando is out, but good morning to him as he attends to other duties. Justin, good morning to you.
Good morning to you, and good morning to our listeners listening and also viewing us live on Facebook.
Yeah.
Yes, Carlty is a busy bee, and so he's conducting some training sessions for a few days for this week. So we wish him the best in that. And on Sunday was Mother's Day, Judy.
Yes,
so we want to
yes.
take this opportunity. I wasn't there last week,
Right.
with you guys. Wishing all mothers a very happy Mother's Day, even though it has passed already, but appreciating you. But yes, I'm happy to be here.
Yes, of course. Mother's Day was on Sunday,
Yes.
and Jolly's, as usual, sought to recognize customers, the mothers in particular, with the Mothers Village held at the Mega Store on Saturday morning. And it was indeed a pleasure to serve the mothers on that day. So I know the mothers who turned out to the Mega Store on Saturday would have enjoyed the Mothers Village, which is, carried to be an annual event. So, you need to always keep your eye on Jolly's Pharmacy, because the initiatives are always on and bubbling for the customers and to make the customers feel appreciated. So at the Mothers Village, there were massages, there were sampling of different products, or Halib Orange vitamins. There was also Choco Dominic sampling and makeup tips and makeup demos from Queen to Queen Artistry. So it was a nice little vibe for the mothers on Saturday at the Mega Store. So, just if they missed out, I guess they have to wait for next year.
Yes.
The mothers have to wait for next year. But I trust that, all the mothers out there enjoyed their time. And yes, and Sunday itself was pleasurable for the mothers out there. Just it is extremely hot. Of course, it is the fabulous month of May. In studio, there are two May ones. I will just cue you in on that. And May, of course, is the most fabulous month. But just it is hot. It is hot.
Very hot. I mean,
yes.
You've seen me in my black jacket, but it's just because of the AC. But outside, it's unbearable sometimes.
Yes.
Especially peak time of the day. So between 12 o'clock to 4 o'clock or so. Yes. It's and at nighttime, you would think it would be a bit cooler, but even with the fan on, it's hot air.
It's hot.
So right now we have to do things to keep hydrated.
Correct.
Especially for children, elderlies, that are more prone to dehydration. If you're outside, if you're a worker, outdoors, ensure that you wear your light clothing, you have your big hat or cap on. Sunscreen protection is very important, and of course your fluids, so water, coconut water, fluids with electrolytes as well. Just ensuring that you do all in your power to stay hydrated and to protect your skin as well.
Right. So and these are tips I think we'll be continuously sharing, because yes, the heat is on in this month of May, but it is predicted that these high temperatures will persist
Yes.
all the way to the month of September,
Mhm.
where it is predicted that it will be even hotter. September, the months of August and September, actually. So we do have to keep reminding our listeners of how to stay healthy in this heat wave that we're currently experiencing. And yes, and the hydration being so important, the skin protection. I know a lot of people are feeling particularly drained and fatigued
Yes, that's one of
because of the heat.
right.
So, mhm,
But of course, it's we can't do anything much about it. But
yeah,
keeping our vitamins up,
mhm.
again, staying in the shade as much as possible, and still, doing what we can to stay energized, even though we may feel a bit drained.
Right.
So,
And and being cognizant of how hot it is, try
yeah.
not to overexert yourself if you are, in an extremely hot situation and there's no sort of opportunity for you to cool out. Try to make sure that you take it easy so that you don't, get so dehydrated and so fatigued that you pass out. So it's the heat is on, but we want everyone to do their best to make sure that they stay healthy in this summertime heat. So Jacinta, we have a big show planned. I want to encourage our listeners, if you're listening on the radio airwaves, that you can log on to Q95's Facebook page and check us out live, and also the YouTube channel of Q95. We are on live as well. So if you want to check us out, if you want to get the view of what's going on here in studio, feel free to log on. But we do have a guest in studio this morning, and we do have a big discussion planned, a big topic planned. So I just want our listeners to definitely gear up for that. We always bring the vibes on Health Vibes, you know that already. So we're going to take a quick break. When we come back, we will be introducing our guest and our topic. So stay tuned.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Are you tired of using deodorants that soil up your clothing and just don't work? Introducing Babyliss Invincible Deodorant, made with all natural ingredients, including beeswax and arrowroot. Our deodorant is gentle on your skin while still providing long-lasting protection against odor. Say goodbye to harsh chemicals and hello to all-day freshness and confidence with Babyliss Invincible Deodorant. Try it now and experience the difference for yourself. Available at Jolly's Pharmacy.
And we are back. Of course, this is Health Vibes. And as I promised before we went on break, we do have a guest in studio, and the guest is going to be leading us through a very interesting topic this morning. This morning, we are going to be talking all about the heart and keeping it healthy. Cardiovascular health is what is our discussion topic this morning on Health Vibes. And joining us, we have our newest cardiologist here in Dominica, joining us here on Health Vibes this morning, Dr. Michael Reef. And I will allow Dr. Reef to give a little more information about himself, and and let our listeners know exactly who he is. But we're very pleased to have with us in studio this morning Dr. Reef to guide us through this discussion about the also important heart and how to keep it healthy. Dr. Reef, good morning to you.
Good morning, Miss Christian. I'm saying Miss Christian because she was formerly my teacher at the Dominica State College. Very inspiring teacher. Welcome again, and to thank the Health Vibes for inviting me here to this forum here to share a bit of my knowledge. Also, Jolly's Pharmacy for opting for this type of forum to share the information with the public. I think this is much needed. My name is again Dr. Michael Reeve. Recently graduated from a very prestigious institution, the Manos and Mahedras Hospital in Cuba. As to why exactly I chose cardiology,
Yes, I want to know.
that-
Why specialize in cardiology?
I remember clearly I was in second year of medical school, and I was a student teacher at the same time. And I found cardiovascular physiology one of the hardest physiologies to understand. I had my share of difficulty passing an exam at the end of the semester, and I figured, um, why not just try to conquer probably the most difficult of physiology areas, and if I was able to be successful at that, everything else should be relatively easy. Secondly, considering that cardiovascular diseases worldwide are the number one cause of death, I think among blacks who lack sufficient representation in those areas, so I decided to instrument myself in becoming a cardiovascular doctor and aiding the people of Dominica and the rest of the region.
Nice, nice. Okay, Dr. Reef. So the intention is to help out at home.
Definitely.
Okay,
Definitely.
all right. I like to hear that. I like to hear that. We indeed need, we need the expertise here. But Jacinta, I will pass on to you because Dr. Reef said something and I know you want to maybe ask about it. So I'm going to pass on to you. But about the number of deaths and we have associated with this one
Right.
area. So that really piqued my interest.
Yeah, so certainly. So you made a statement that cardiovascular disease is one of the main causes of death. I'm sure during your studies, your internship in Cuba, right?
Thank you.
And also here in Dominica, this statement is very true, and for the rest of the world as well. Tell us what you have seen in terms of like the risk factors associated with cardiovascular disease. Why is the level so high in terms of the death rate or many people suffering with those type of diseases?
Right. As we both mentioned, again, cardiovascular diseases represent the single figure as the highest cause of death internationally. Yes. Based on my experience, I have seen changes in the epidemiology when it comes to cardiovascular disease. And when I say cardiovascular diseases, I speak under this umbrella is strokes, the heart failures, the heart attacks, the peripheric artery diseases, the peripheric venous diseases as well, the kidney failures, right? Hypertension. So not just the concept of the heart being involved, but anywhere arteries flow, blood flows through arteries, I consider once a pathology is associated with that, we consider those cardiovascular diseases, right? And under the specialists in cardiovascular disease, we have the nephrologists, we have the cardiologists, we have the surgical specialties which are associated with those, which are cardiothoracic surgeons. We have also the angiologists, vascular doctors, the neurologists, neurosurgeons as well, right? As to why exactly there are so many deaths pertaining to cardiovascular, which caused by cardiovascular diseases, is because of the prevalence of hypertension. Hypertension, we have made significant waves in the last 30, 40 years regarding treatment for hypertension, but some of our risk factors continue to persist. Hypertension is the single most common cause of cardiovascular disease and complications. Okay. And this is so prominent because why? Because of our bad eating habits that we continue to take on in terms of high intake of salt, in terms of high fat intake, whether it's fried fast foods, lack of exercise despite how common gyms are, and at least consistency at gyms. I must admit myself, I start 1 month, I pay for 1 month or two, and then the next 10 months of the year I tend not to go to the gym. So I find myself guilty of that. Smoking is a very important one of those risk factors that contribute a lot to the development of cardiovascular diseases, particularly the heart diseases and peripheric artery diseases. So once the levels and the numbers of smokers continue to rise, We expect that the frequency at which cardiovascular diseases appear should be more frequent, and the deaths associated should be at the same wavelength. So the factors, the persistence of these risk factors lead to our prevalence of our cardiovascular diseases internationally.
Right. Even so, we advocate for continuous testing of our blood pressure levels. Evaluations are very important, following up with your doctor appointments, because you're stating, which is very accurate, that high blood pressure is one of the main causes of cardiovascular diseases. But high blood pressure is like a silent killer. So many of us are walking around. We are not aware of what our numbers are. And so until complications arise or where it reaches to a level where we feel unwell physically, or we just happen to go for another checkup, nothing in relation to our blood pressure per se or directly to our blood pressure, then we may get that diagnosis. But I know that you will always also tell us that high blood pressure is not only diagnosed on a one-time basis of a high blood pressure reading, but over a period of time consistently having high blood pressure readings. Sometimes patients may be in denial, saying, "Oh, it's just a one-time thing. I was a little stressed out over the weekend, or I'm going through a phase in my life where this may cause my blood pressure levels to be elevated," and then don't take the medication, don't follow up, and then other complications arise, and then that's where you have a higher rates of death and other health concerns.
Definitely, as you rightly said, hypertension is indeed a silent killer, which requires a bit more discipline from the general public to show some level of concern and vigilance for their health. It's a condition that usually debuts with a complication, either stroke, kidney failure, heart attack, angina, peripheral artery disease. During coincidental screening, they may discover that they have hypertension. As rightly said, diagnosis of hypertension aren't made based off one reading. In most cases, no. That could be the case if systolic blood pressures are extremely high, exceeding 180. Or it usually has to be diagnosed when there are 2 or 3 readings a week apart, when blood pressures are exceeding 140, systolic blood pressure exceeding 140, and diastolic blood pressures are exceeding 90 millimeters of mercury. So it's something to take and something to give at the same time, because often enough, as you rightly say, people say it's just a one-time reading that, hey, my blood pressure is high. But if it's a one-time reading, is what type of blood pressure that you are. If you're managing a blood pressure of 180, one reading of 180 is sufficient to make a diagnosis of high blood pressure, to say that you've been chronically suffering from high blood pressure. And it's almost necessary to define high blood pressure as a chronic elevation of BP stats. All right, irregardless, it was diagnosed in one occasion of an excessively high blood pressure reading, but that one reading shows that, all right, it has been discompensated for some time and it only gradually reaches its peak. So that's why we are identifying it now. But same thing comes when it comes to diabetes. There are certain criteria for diagnosis of diabetes, which are, once you take one reading in excess of 200, all right, 200 millimoles, milligrams per deciliter, I'm sorry, or 11 millimoles, you can diagnose a patient with diabetes. Okay. But in most occasions, you require at least 2 or 3 readings, BP readings, a week apart, above the 140 systolic or above the 90 reading. And that's something that both our patients and our healthcare workers have to be aware of, so that they don't overdiagnose or underdiagnose our hypertensions. Because trust me, it's very good to diagnose hypertension. I love diagnosing hypertension because, again, it's one of our principal risk factors that can say, hey, you definitely at risk for something greater. You understand? So it's better we take precautionary measure right now and just control that at this point. So this is something that the public definitely has to know when it comes to hypertension.
Mm.
Try to do yearly screenings.
Let's backtrack a bit, because I want we always seek to educate, of course, on this program, and I want the listeners to understand a bit more about this hypertension that we're speaking of. It's such a popular thing, right? That people, I don't think always digest what really it is. People talk about hypertension or pressure, or I have pressure is how we say it colloquially. I have pressure. But in terms of what is high blood pressure, what is it actually doing? What do we mean when we say somebody's pressure is high? Yeah, we understand the figures, right? But what is it actually doing physiologically to the person when their numbers, as you were just mentioning, Dr. Reef, are elevated? And how does that now correlate back to the heart? Because we started, cardiovascular health we're discussing. And I know some people, might kind of not be aware of the vascular components that we are, in with that hypertension discussion. So I want you to, Dr. Reef, to kind of bring in
Break it up.
what is this elevated pressure? What is it doing? And how does it now all link back to our cardiovascular health? Mm-hmm.
All right. Well, this one caught me off guard. I didn't expect to,
No,
to
I
be
have
explaining physiology.
I
but
have to take you back to
I
the
will.
A&P, of course.
I definitely enjoy doing it, so don't worry. When we speak of blood pressure, we speak about force.
Uh-huh.
We speak about the force at which blood hits the walls of our blood vessels. And when I say blood vessels, it's a fancy way to say veins and arteries.
Mhm.
Okay? Particularly when we speak about hypertension, we speak about arterial hypertension, not venous hypertension. Arterial hypertension. So the force at which blood comes into contact with the walls of our arteries. So if the pressure is high, we say you're expecting a high force at which the blood meets or comes in contact with the wall, with our blood vessels. So if, again, just practically thinking, if the blood pressure is high and a high force of blood meets the walls of our blood vessel, we're expecting stuff like ruptures of our blood vessel, where there is aortic dissections, where there is hemorrhagic strokes, where there is aortic dissection at the level of the abdomen and those kind of levels. All right. So that's why it's so very, and when we have damages into the walls of, let me just say that, persistent high blood pressure, persistent high contact to the walls of our blood vessels causes small injuries to the walls. And those small injuries to the walls of the blood vessel cascade some reactions where there is blood seeping through the blood vessel, so we want to clog that area. And in attempt to clog the areas of the arteries, to prevent blood from seeping out of the arteries, we have formation of blood clots, plaque formations, where imagine there is this blockade in the road where we have triple K to stop with a truck, and as people passing, they just stopping and stopping and stop. Eventually, the road is going to be blocked completely.
Yes.
You understand? So the persistent high force making contact with the walls of the blood vessel cascades all the clotting factors, increases the risk of rupture and blood loss, and consequently death. Okay, the heart itself is considered, I like to consider it a modified blood vessel. The arteries are made up of 3 layers. Adventitiously, I just reflecting on what Miss Christian taught me. I call it a muscle layer and the posterior layer. The heart, much like the blood vessels, and the lumen, which is inside. Okay, so from inside to out, lumen, adventitious, muscular, and the outer layer. All right. Now the heart, much like the blood vessels, have 3 layers. Coincidentally, we have the interior, which is at the cavities. We have our endocardium. We have a myocardium, which is a muscular layer, and we have the pericardium. Okay. And some of the changes the same changes that we expect at the level of the arteries, because of a high blood pressure, we expect the same level. We expect the same changes at the level of the heart. And I want to bring it back to the heart to say this: what happens is, Usually, let's bring it on. Let me use an analogy I would like to use. Sorry, before the analogy, the heart now usually pushes blood into a high pressure system, which are the arteries. Okay. Imagine the pressure in the arteries being higher. The heart now has to work even more. Let's bring it down to analogy. If you're in primary school and you're being bullied by a bigger child, the only way to overcome that being bullied is to yourself become bigger. Right? So that you can now defend yourself and push against the bully. This is the same concept of the heart. If the pressure in the arteries are higher, the heart itself has to engorge. It has to undergo a process we call hypertrophy. Hypertrophy to push against a high resistant or high blood pressure system, which is our aorta in this case. So those modifications that our heart makes cause certain physiological changes that are maladapted to the body, right? Because our heart physiologically is supposed to receive blood to be able to push out blood. So I want you to understand the receiving process as you see this guy who comes from the Jollies gym, and he is so buff that he's incapable of being flexible. And because you're so buff and you cannot bend down and touch your toe because your arms are so big, usually, and I guess the people who work out can relate to that. The buff guys usually cannot wash their backs. You know how difficult it is to wash your back because your arms are so big? Imagine the heart being so restricted by its own muscle that it is incapable of accepting sufficient blood. So again, if sufficient blood doesn't come in, you do expect sufficient blood to leave. You understand? So that's the way our heart failure eventually, we eventually result in heart failure secondary to hypertensive cardiomyopathy. And hypertensive cardiomyopathy is a complex word to say modifications of the heart secondary to hypertension.
Okay, I can visualize that so well.
Yes.
I really like the analogy and how we have gotten to how this affects the heart and its ability to do what it's supposed to do, and that is what is concerning now to us, the owner of the heart, because the heart is something that we need to be able to do what it's supposed to do. Without the heart, we're dead. We always talk about this organ, the heart, as being the one that has to work from the moment you are born to the moment of death. This is the organ that has to continuously work, continuously beat. And if it stops beating, well, we know what that means.
The end result.
Yes. So I like the analogy because I can see now how the progressive nature of hypertension can affect the body. I see we have someone calling in. I was going to give the numbers, but I see we already have someone calling in to interact with the doctor. So let us take this call. Caller, good morning. Good morning.
Good morning, Judy.
Good morning. Good morning.
That's Jennifer.
Hi.
Good morning, Doc.
Good morning. Good morning.
A question to you, Doc.
No problem.
I want to find out about these non-communicable diseases. Is high blood pressure, diabetes, and there's another one, are they associated with heredity, that you get it from your parents? Because there are some people who get diabetes from the parents. Some people. Because as your parent had it, so you have it, and so on, and so on. But another thing, the other question I want to ask you, doctor, does it have to do with your lifestyle, the type of diet that you take? That's the two questions I want. Thank you.
Thank you.
Thank you,
Thank you.
Samuel.
Yes. So, is there a genetic link? He did mention correctly so that there is one to diabetes, but is there a genetic link to hypertension? And then the second one, which I believe you had already answered, but we can take it again: the lifestyle choices. How do they link to this hypertension and other diseases?
All right. So the first question was about communicable diseases.
Yes.
And what are communicable? Communicable diseases are non-communicable.
Non-communicable.
I'm sorry. Non-communicable diseases are diseases that can't be transferred or spread from one person to the other, right? As in cases of infections and other conditions. So yes, hypertension, diabetes, kidney disease, gastritis, and most chronic illnesses are non-communicable diseases. Non-communicable diseases account for the highest concentrations of death internationally as well as cardiovascular diseases form part of that. The second question was the first question was
Whether
If there's a genetic
a genetic link. So
Right.
once your
to
parents
hypertension.
have this condition, would you automatically acquire this condition?
all right. Yes, the answer is twofold. Yes. There is a genetic component to hypertension as well as diabetes. Diabetes has already been explained. So there are certain mutations that could be passed from one parent to the other, and children at anywhere between 1 and 14 generally develop type 1 diabetes. But those are usually associated with certain autoimmune bodies attacking certain cells that are in the pancreas, resulting in type 1 diabetes, right? Insulin dependent. All right. Hypertension, much like diabetes, there are genes that are coded for hypertension. Okay. And awareness, that's why when you come to a clinic, one of the things that you usually ask, what is your family history? Okay. But it takes more than just genetics to develop hypertension. Right? So that's why I usually tell patients that, hey, I know your parents hypertensive. You don't have to accept the fact that you're going to be hypertensive.
Right.
There are things that you can do to prevent. And that's why preventive medicine is so important. If you have a family history of hypertension, you should indeed take more precaution when it comes to your health than the average person without the history, because you are 3 times more at risk to develop hypertension as compared to the rest of the population. Okay, so it's a combination of genetics, environmental factors, and I say environmental factors, I mean our lifestyle that we want to speak about, the lack of exercise, sedentarism, obesity, low economic statuses, because low economic statuses as well contribute to hypertension, lack of education, being incapable of reading and writing and understanding good from bad, from unhealthy from healthy, all those contribute to the development or the perspective of suffering from hypertension, in fact. So again, it's a combination of lifestyle choices and the genetic components that are associated with it. So if the question is, will you automatically suffer from hypertension or diabetes because your family member has presented it? No. That's the direct answer. But the soft side of it is you are more at risk.
Right.
Again, the more at risk, a risk factor is anything that predisposes you to suffering from any condition. So yes, you are at risk, but it doesn't automatically qualify you to be diagnosed with hypertension. You must consider the lifestyle choices that you make on a daily basis, which may contribute to the development of that condition. Yes.
I'm very happy that you explained this so nicely, because we have many patients coming into the pharmacy on a daily basis that accept that they will inevitably, or how should I say, have
Get
this
a disease?
mentality, right, that they will automatically get this condition just because of their family history. And so when they have this ideology that it's inevitable, then they are very complacent with their lifestyle choices. And even with their medication regimen, they're like, oh, well, I have it already, so we must die of something. And it's very unfortunate, to have patients have this type of mentality, because yes, okay, you're already at higher risk, and with the knowledge of this, you're still not taking the necessary steps to at least reduce your complications. So let's say if you've already been diagnosed with high blood pressure or diabetes or high cholesterol levels, and you still continue on the same lifestyle practices. So it's very unfortunate. But Miss Luther had a
The second question is answered. It's
Well,
whether
it's
the
what
lifestyle
lifestyle
choices
choices. Yes,
contribute
okay.
to, to hypertension. And yes,
And
they
yes, it
do.
does.
Yes, they do. The diet, the physical activity or
Right.
inactivity, so to speak. And, the doctor mentioned smoking as well as being one of the major factors as well. So yes, the answer was yes to that.
Yes.
I wanted Dr. Reef to specifically now ask, what have you seen, through the course of your studies in specializing in cardiology, and your own interaction with patients? What have you seen being one of the, I would say, dominant factors affecting, or one of the prominent heart diseases? I know a lot of people talk about or are scared of a heart attack, right? But what have you seen? We've spoken about hypertension, but what is there anything else you've seen specifically relating to the organ itself, the heart, that is, particularly popular?
Okay. Again, from what I've seen from my experience, heart attacks definitely has been a bit more prevalent.
Okay.
And I mentioned initially when I started speaking that the epidemiology on that has changed. Generally,
Okay.
the population which suffers from heart attack are women above the age of 50 and men above the age of 40, as men usually lack a very important hormone which women possess, are blessed to have in higher concentrations than as estrogen. Estrogen acts as a cardio protector in that it's a natural innate antihypertensive medication because it causes vasodilation.
Okay.
Secondly, it acts as our statin medication, and you should be a bit familiar with the atorvastatin, the rovastatin. It acts as one of those medications by decreasing our cholesterol levels in our body. Now, when women undergo when women
Go for
go
menopause.
through menopause,
Mhm.
the levels of estrogens
Drop.
drop. So that is why heart attacks
After-
become more prevalent and hypertension becomes more prevalent after the age of 50, which men, unfortunately, we have to deal with since we 30 years and up. You understand? So, but again, those are theoretical because, again, from my experience, what I've seen in the last 4 years of practicing cardiology, studying and practicing cardiology, the epidemiology on this has changed. I've seen a lot of 20-year-olds develop hypertension. I've seen a lot of 20-year-olds develop heart attacks. Why? Because at a young age, when I was younger, my parents used to give me Tolomans and mid-school children buying KFC, and our eating habits have changed. And our kids have adopted some of those. So the atherosclerosis process, which my teacher explained to me when I was in college, no, usually it starts at about 30 years and manifests about 50. And now, in our modern day, the 10-year-olds, it could almost start at about 10 to 15 years of age because of how much fried foods and unhealthy foods that we are eating now in today's time versus 20 or 30 years ago. So we find again, I would say the epidemiology and all this has changed. And secondary to that, the heart failures and even what has become more and more common, our DVT, when I say DVT or deep vein thrombosis.
Okay.
And it may or may not, a lot of people assume it has been associated with the COVID-19 vaccine or the condition in itself. All right. At the hospital every day, you will see multiple people with elevated D-dimers, and there are many causes of elevated D-dimers and DVTs. But I have noted that in the last 3 years, I've seen significant amounts of pulmonary embolisms and DVTs and anything that is associated with thromboembolic conditions, hypertension,
clots. Okay. So that is so interesting. I want to ask then, doctor, how do people know that, for instance, or what are some of the signs then, or are there any signs and symptoms of some of the things that I want to ask specifically about a oncoming heart attack. That is what I want to ask about. Any signs, and for this blood clot prevalence that you see in your DVTs and your pulmonary embolisms, any signs, or are these things that just
Yeah.
hits you?
These conditions are not like our heart attacks. They present with very typically, or even with prodromal symptom, signs and symptoms. Okay. So typical DVT presents, or the vein thrombosis presents with the unilateral or one-sided leg inflammation, which usually is very painful. You're incapable of walking on it. It's dark in coloration, showing signs that we have and swell. So it's swollen. So it's a unilateral changing coloration and swollen leg, which is impossible to ignore because of how painful it is. Usually in these cases, if it was bilateral, we could have associated with other conditions like peripheral artery disease and those kind of stuff. But considering that it's unilateral, those are the telltale signs of all deep vein thrombosis.
Okay.
Now, if our patient who has a history of the vein thrombosis presents with difficulty breathing, tachycardia, and when I say tachycardia generally represents as palpitations. You feel your heart beating out of your chest, right? You touch your chest and it's beating at 100 beats per minute. I mean, you may not be able to quantify, but you know when your heart is beating quickly. You couple that DVT signs with our signs of shortness of breath, our chest pain, and our palpitations, which is expressed by our heart beating quickly in our chest, we can almost assume that our patient is having a pulmonary embolism secondary to a DVT. Okay, and this in itself is a medical emergency, which requires you to not go to the health center and spend half an hour to go to the hospital. Regardless, they're going to tell you to go back to your health center and come again. But you're there, they're going to treat you. So it requires you to go to the A&E department of the Dominica China Friendship Hospital and sit there and say, "Hey, I am experiencing something that I think is abnormal. Check me, please." All right. Our heart attacks usually are very typical. They present with very typical chest pain, which is a substernal pain, and I say substernal pain that is to the center of our chest, to the back of our sternum, which is the center bone in our chest. It usually comes on when we are exerting, or with exercise, I should say. It usually lasts anywhere between 5 to 20 minutes. Chest pain that lasts shorter than 5 minutes, generally isn't chest pain. It generally isn't signs of a heart attack. It's usually a next condition that may develop somewhere in the chest region, as there are many organs like the esophagus, the rib cage. There is many other things or even the lung, that can cause pain. But again, we're talking about a substernal pain, which comes on with exertion. You feel like you're having a crushing tightness, heaviness in your chest that usually spreads to your left shoulder and arm, or even your neck and your neck and your jawline. So those signs are things that people need to be aware of. If your chest is hurting you, don't ever stay home. If you ever go to your health center and you have a history of gastritis, tell them I need an EKG done, please, because I have a history of hypertension and diabetes, and I don't want to take any chances. Instead of having them send you, because automatically this is medicine. I'm telling you how medicine works. If you have a history of something, if you have a history of asthma and you come with shortness of breath, I'm going to say you have asthma. Without having done the X-ray, I'm going to say you have asthma, and I'm going to send you home. But again, if you do not tell your doctor certain things, they aren't aware of certain things, they won't diagnose you. Now, if you tell them you have a history of gastritis and your chest pain and your chest hurting you right here, right above your stomach, right there, they're going to assume that you have gastritis. They're going to get omeprazole and send you home. You're going home to die. Now, if you have a history of hypertension, doctor, I don't smoke. And you have to be honest with them. You don't tell them you stopped smoking 3 years ago and you know you're smoking last night. I smoke. I eat KFC as often as possible. So I know my dietary lifestyle is not the typical. I know you're seeing it, but I know I am overweight. I know I'm hypertensive. I know I'm diabetic. My chest is hurting me, and I hear on Q95 Health Hype that if you're having chest pain that starts when you're walking, when you're doing exercise, that I should get an EKG done because I'm possibly having a heart attack and I want to help you. I just want to help facilitate your job. So if you cannot do the EKG at the health center, send me to the A&E department. Those are signs and symptoms that you need to be aware of so that you can prevent any more extensions of heart attacks. We can give you the treatment in the window that is required, because you usually have a 2-hour, 3-hour window when it comes to thrombolysis and stuff that or therapeutic options that are associated with heart attacks. And you want to be able to be in the right space at the right time for those options. So yes.
Okay,
We have a
make sure you tell the doctor you eat KFC as often as possible. We have a call. Let's take this caller. Caller, good morning.
Good morning,
good
Hi,
morning.
good morning.
and how are you all?
We're
Not too bad,
good.
thanks.
Okay. I like this doctor attitude. He say it as it is, and I love people who says it as it is
Thank you so
because
much.
I am one of them. When I go, I usually have my special doctor, and when I go to him, he has to know all the medication I'm taking, whether for pressure or whatever, without the asking. I bring my book, I bring everything. And I will always ask the doctor, can I take that with that I am taking already? Then, I like to communicate with my doctor well, very, very well. I doesn't leave nothing behind. I don't know if it's because I work a long time in hospital before, but it is in me. And doctor, I would like to know what is the benefit of Toloma. You said it so fast, but I pick it up because it is something I love. And the last one is Nurse Riff, your sister.
Nurse Riff is my mom. Nurse Riff is my
Oh, wow.
mom. Nurse Riff is my mom.
Congratulations to Nurse Riff. I was in Vine Hospital.
Oh, wow. I'll definitely tell her you called it.
Oh, wow. That's good. Congratulations to her.
Yeah.
Take care.
Yeah, no
The
problem.
benefit of Toloma. Take care.
Thank you, caller. Yes. So congratulations to your mom, Dr. Reef. Not to you,
Not you.
but congratulations to your mom. I like that. I like that. But yes, you did mention earlier that back in the day, their children would get Toloma, and now it's something different. So just restate what you were saying about Toloma for
I
our
feel
caller.
like I walked right into that one. The sad part, I actually don't know the benefit of it. So, caller, I don't know, to be honest. I would have to go back and read on what are the health benefits associated with Toloma. Again, it was just a random food that we used to eat then that I just draw reference to as opposed to the people who eat in their fast foods in this modern day. Yes.
Yeah. I guess you're saying, it was a less fatty option that was
Yes.
chosen before, and now it's the popular fried stuff. That is what you're saying. But you picked up on the Toloma specifically. Let me just give our listeners the numbers that they can call in and interact with Dr. Reef. Of course, we are discussing cardiovascular health this morning here on Health Vibes. The numbers, if you'd like to call, 449-3095, 449-3096, 449-3097, and the 616-4257. Of course, if you're calling us from overseas, you can call on 305-432-9624. Dr. Reef, just before we continue, there was a question on the Facebook Live as it relates to smoking. You did mention it's a risk factor for our hypertension and cardiovascular disease. The listener asked what type of smoking, and this is always a big debate, yeah?
Nice. Let me just say that as we're speaking on risk factors, our most common risk factor associated with cardiovascular disease and complication is hypertension. Our most severe fatal of risk factors associated with cardiovascular disease and complication is diabetes. And our risk factor, which almost immediately increases our risk for complications, is smoking. And when reduced, it is the quickest of risk factors to revert us to almost normal, right? Smoking itself accelerates our atherosclerosis process. Sclerosis means hardening.
Right.
Arterial refers to the formation or the deposit of fatty
Fats.
plaques. Right? So it's a combination of hardening of our arteries and the deposit of fat. And that combination causes blockage of our arteries and decreasing blood flow and ischemia, which is the basic physiopathology behind cardiovascular conditions. Right? Smoking, you ask what type of smoking? Both, you can say first hand and second hand. Second hand being the more severe and significant out of the two. So I'm not saying, do not hear me wrong. I'm not saying it's better to smoke directly than to
Directly.
secondhand smoke. I am saying secondhand smoking is worse than you pulling out cigar. I listen to them, cigar, cocaine, marijuana, that is the healing of the nation. Once it is congested and once it is consumed through the mouth, right, by smoking, it is harmful to our cardiovascular system. And an important fact: one, smoking, whether it's cigar or marijuana, one of the things that people often die from, which is not highlighted a lot, is bladder cancer. Why? Because the nicotine spends more time in our bladder than it does anywhere in the body. It spends more time in our bladder than it spends in the lung. It spends more time in our bladder than it spends in our vasculature, in our veins and our arteries. And eventually, after persistent 10, 20 years, we have in our patients developing bladder cancer and all the other cardiovascular conditions because of the arteriosclerosis. So yes, both first hand, second hand, third hand, fourth hand household smoking increase our risk of developing cardiovascular diseases and their complications.
Yeah, I definitely think when the listener asks what type of smoking, it's that debate between the cigarette smoking and the marijuana smoking, which we often hear of. Is any type of smoking healthy? And we've gotten the answer, I think, from different guests right here on Health Vibes that no, the smoke in and of itself is the unhealthy, the unhealthy factor. I know the listeners like to ask this question. I see we have a caller calling in. Let's take this call. Yes. Caller, good morning.
Hello, morning, everybody.
Good morning.
How are you?
That's good.
I want to ask the doctor a question. It's not controversial, no, but kind of. Doc, what are your views on taking herbal medication? I know some people can you take herbal medication in the doctor's medication. What are really your views on this herbal medication? Everybody talking about herbal. Thank you.
Thank you. Yes. So herbal medication question.
Right. So the question is, what is my views on herbal medication? All right. I'll start with this. I am never against the idea of herbal medicine. Natural medicine was a thing before we went into the labs and we designed all the therapeutic options that we have today. Now, again, I hope I answered your question. I am not against it. My problem lies when patients think that they can substitute our pharmaceutical options for herbal or natural medicine. They should be used in conjunction, in combination to reach our target blood pressure readings that we want. Again, they are useful. They are very, very useful. Herbal medication, they are very, very useful. Once you know exactly how to prepare it, whether it's boiling it for 5 minutes, whether it's unsweetened, whether it's sweetened, whether it should be. Once you know how to properly prepare it, I recommend it for all patients. Herbal medication, like the pharmaceutical options, they do have contraindications and they do have adverse reactions associated with them. So again, the public tends to think that only the drugs have adverse effects. No, because there are certain hypertensive, antihypertensive herbal herbs that also act as blood thinners. And what good would it be to drop your blood pressure but you're bleeding out internally? So again, you must consult with your doctor, with your general practitioner about before taking certain herbal medication, especially if you are a person who have comorbidities that you are taking different sorts of medications for. I made a list of certain herbal medications that are beneficial, and what seems to overlap between lowering blood pressure, bettering our circulation, and decreasing our blood sugar are garlic, cinnamon, turmeric, ginger, thyme, parsley, hibiscus, rosemary, cayenne pepper, green tea. All these, some of these herbs act as our calcium channel blockers. Some of these acts as our ACE inhibitors. You understand? And I would always tell my patients, if they can take herbal medication, take them. But do not substitute the medications that I have prescribed, or we have prescribed, any of your doctors have prescribed for these herbal medication, for these herbal therapeutic options.
Mhm.
So, just so that I can clarify, when Doc mentions about calcium channel blockers and ACE inhibitors, those are classes of anti-hypertensive medications. I'm very happy again that you mentioned those because, as a pharmacist, we have many patients coming in saying that they have herbs taken already, or they're already on prescribed medications, whether they can take them together, whether they should, what are the benefits, what are the risks. And those are very important questions. Unfortunately, many patients, without consulting their pharmacists, nurses, and doctors, they stop taking their prescribed medications. And the prescribed medications have different ways of either lowering blood pressure, blood sugar, cholesterol levels. And as Doc rightfully said, herbal medications, would there even be four, the synthetic ones? The benefits of them are many, right? I actually brought
Yes.
quite a number of the supplements we have on our shelves at Jolly's Pharmacy that can be used. Garlic, he mentioned it. We had the combination of garlic and parsley together. Omega-3 of fish oil or flaxseed oil. I guess our viewers can probably see the bottles that I brought. And in one way, shape, or form, they either target the blood pressure, so in controlling the blood pressure levels or lowering cholesterol levels, sometimes due to high inflammation in the body as well, that can also impact our cardiovascular health. And then there are those like the CoQ10 that also help with heart health, so general heart health, helping with lowering cholesterol levels. So, I mean, there are a wide range of benefits of the different types that we have available. But as Doctor mentioned before, just going on by every single supplement, because they are beneficial to our cardiovascular health, speak first with your physician, pharmacist, nurses as to what you're already taking and if it is safe enough to use and how to be used, because many people overdose or have multiple doses throughout the day. So that's very important to note as well.
Mhm. And something the doctor mentioned that is important about stopping your prescribed medication for an alternative, when particularly when you don't monitor what is the outcome of that cessation of you taking your prescribed medication for something else, and then you allow your issue, if we're speaking of hypertension, to then get out of control. And as the doctor mentioned earlier, now prolonged, excess force, that hypertension that we're speaking of, that excess force of the blood on the blood vessels and on the heart too, will cause all these things that we don't want. The tearing and rupturing of the vessels,
Right.
the heart becoming enlarged, hypertrophic. So I really feel like sometimes if we have certain medical conditions, and in this case we're speaking of hypertension, and people choose to do something different, they say, they stop their medication, whatever, but not being very aware of how for a period of time you allowing yourself, if this thing is not under control, to be subjected to the negative outcomes
Outcome.
that it's causing to your body. And that to me is disheartening. I know particularly for men, I know the doctor might can maybe speak to that, who like to say they're stopping the medication because this is the impact that it's having, and they don't want that, so they won't take
They
any
and they
blood
wouldn't say
pressure medication,
anything. They wouldn't
don't say
mention.
anything to their physician, but they have just decided they shall stop. And the blood pressures are elevated with no kind of recourse, and the damage is happening internally.
But before Doc tags that area, I want to mention another concern briefly. Not concern, but what we've realized in the pharmacy, it is possible, and doctor will speak on that as well, that doctors will reduce either the number of blood pressure medication or blood sugar medications or so forth, or the dose based on your blood pressure levels
numbers,
or
yeah.
your numbers over a period of time. So many people are concerned about the number of medications that they're on, and so they pick and choose. Okay, I will take this one today and probably skip another one tomorrow, and probably not follow up on the number of doses. But if your lifestyle regimen falls in line with your physical activity or your diet and so forth, it is possible, depending on how disciplined you are, that the number of medications and the doses can be reduced. Okay, so I wanted to
Yes,
say that point
I
as
see.
well.
We okay. So we are. There's some people trying to call in. Let me just ask you to try again. We do have some time left. Of course, we're discussing cardiovascular health here with Dr. Reef on Health Vibes this morning, and he is our newest cardiologist, as I said earlier, our newest cardiologist on the block here in Dominica. The caller is back. Let's take this call. Caller, good morning. Good morning.
Hello, good morning. Fireman touching base, health and wellness. I am in the business. No, and doctor, good morning to you, sir. I am studying Cuba. I love that because Caribbean and I work a little bit, right? No, well and truly, my lord, you see the problem we have in the Caribbean altogether. You see the food, you see the food that man making and non-man do it in God food and man it is only man food they make. That's a serious problem, you know. You know something again? You know a lot of people eating bad. You know what I'm saying? But right now they're well and truly from since the COVID, you know, I ain't talking about smoke. You see me? I don't smoke, I don't take no job. I don't smoke cigarette, but I smoke my winter vegetable. And when the COVID virus, you know the COVID it spread me because why I have a fire food. You know what I'm saying? As a fire food, we are taking the winter vegetable all the time. I'm not saying you have to take a winter vegetable and go anywhere and do certain things. You have to respect the people and respect yourself. You know what I'm saying? But the cigarette now is a thing that it have a chemical in it that destroys humanity, both internationally, locally, and regionally. Even you smoking it and giving to the other, it's same thing. You know what I'm saying? But no, I already talk about herb. That's why I'm telling you, I know something wrong. If the Bible have a problem, or man can have a problem. The Bible tell you what the Bible say. He give you herbs for your food and your medicine. But when the people are using all kind of crazy things, herbs can help all you. Herbs cannot help all you. All you have acidic body, all you have acidic brain, all will going to disappear. If you have an alkaline body, you eat alkaline food, all the herbs will work with you. Get it real. You know what I mean? Somebody eating a hamburger taking 2 weeks to digest in your body. You eating 3 hamburger in a week. Now, let's get it real. What doctor can help you? No doctor can help you. No nurse, nobody can help you. You have to help yourself. You know what I'm saying? So right and truly now, people choose a whole heap of old habits, destroying themselves in all. You're some from Emmanuel Grandbound, some of them all the countries to be so healthy and nice. Right now, all you see now, man, they big belly, big tete, that man, big belly. No, but something not correct. You know what I'm saying? Something is not correct. No doctor, no nurse cannot help all you. Partner, love life. Know what all you're dealing with. Respect all yourself. Eat healthy. Change all your life for a little while. Eat healthy. Don't eat for it. A lot of people are eating to full their stomach. When you're eating to full your stomach and you have your issue, you can bring it in the hospital and come and say, oh, hospital look good, nurse look good, doctor look good. Partner, you is your own self problem. Help yourself and nobody will help you after. Anyhow, I'll let you call on the medical to say because it's hurt to you. Certain people now doing all kind of crazy things with their life, and when they ready to come and blame the hospital, blame the nurse, blame the doctor, blame your partner, use your own self problem. Eat alkaline food. Right now we have a whole heap of water crisis in the country. Even right now we say it's on hot. A lot of people have been drinking a lot of water. It's a whole heap of dry food. Pale out, dry food. Before we say full and sauce. Right now, the only for dry food.
Thank-
You give in the blood too much work. So your bladder and all the instruments inside must have a problem because it's not working correct. But now you still get blood clot. You know you can come back again because your blood not
Thank you,
circulating properly. Your chuchong can work properly. Your chuchong going to be dead. You killer comes up when your blood down. Up and running.
Caller, yes.
Fireman running. Best of all
Thank you. We have another call on the line. Let's take this caller. Caller, good morning.
Yeah, good morning.
Good morning.
Yeah, I hear you guys talking about high blood pressure. I would like the doctor to tell me what do we know about Celtic salt?
Celtic salt.
Yeah.
Okay.
Normally, if your pressure is going up, you just take a little push on it and just put it in your tongue, and it brings down your pressure.
Mm. Okay. So thank you. So doctor, have you heard of what the caller has just referred to, Celtic salt?
I've never heard the terminology Celtic salt. Salt
Okay.
usually does the opposite. Increase.
Increase. Mhm.
But if there's a type of salt which does I cannot deny it. But I'm unaware.
But you're unaware. Okay. All right. Thank you. Okay. So yes. So as we've been discussing, cardiovascular health, some of the risk factors to some of the diseases that we see that are prevalent, hypertension, we mentioned a lot. And before we started taking the calls, doctor, you had spoken about some of the signs for a heart attack, which I felt were very instrumental. I just wanted to look back to that quickly because I know sometimes when we speak of chest pain, people get concerned often with chest pain. And I like how you really said what type of chest pain and what would you be doing when the chest pain arises and that kind of thing and how you should approach that. So I really hope that at least that part is a good takeaway for our listeners as it relates to heart attack. Doctor, I wanted to ask too, are there anything or any things apart from what we've already discussed that people can take to protect their heart and their cardiovascular health as they get older? So this is the aging question. We've spoken about the diet, the lifestyle. Are there any things that are recommended for aging cardiovascular systems? If I'm saying this properly, I don't know.
Okay.
Your aging patients.
Right. Our aging patients, we as doctors, we tend to be a bit more careful with the geriatric population, as they sometimes respond excessively to our medications and all our therapeutic options. They cannot undergo intense workout as a younger population. They cannot eat. They're a bit more sensitive to the salts and the other dietary stuff. And usually we just recommend for Asian population to be a bit stricter with the same diet, with the same medication. Sometimes you may want to reduce your doses of some of your medications under the consideration of your general practitioner. Reduce the amounts again when you come back to the diet again. Reduce the amount of cholesterol. Your targets might be a bit. Should be a bit lower. LDLs, you try to reduce LDLs to somewhere about 70, as compared to a regular person could maintain an LDL of about 150. So we wanted to get anywhere below the 100 mark, 70 to 100. The oils, the selection of our oils. Once you go to the stores, to the grocery shopping, we try to look out on the cans and choose the foods that have least amount of cholesterol and fats. Usually our canned foods are labeled red, amber, and green. They are labeled red, amber, and green because of the cholesterol content. Right? Red being those which have the highest levels of cholesterol. Amber and green have lower levels of cholesterol per 100 gram of whatever food that is. Okay, so you want to select the canned foods or whatever foods which have the amber or green labels.
Not red.
Not red. Red is an absolute no, especially in the older generation, in the older population. Also, when it comes to oils and we want to use more oils that have least amounts of cholesterol as well. When it comes to milk or alternative milk options like the almonds and the nuts, the milks that come from those, they have less amounts of cholesterol, and the alternatives have more omega-3s, which are and more HDLs, which help us with our cholesterol balance in the entire body. So again, diet selection, lifestyle is the most important thing when it comes to our geriatric population.
Okay. Taken. We have a caller. Just let us
Yes, we
take the caller and then your
One last
question. Yes. Caller, good morning.
Hello. Good morning.
Good morning.
I would like to ask the doctor a question. It have the white salt we normally use and a pink salt. So is it the
Himalayan
pink
salt.
salt? I don't know the real name, but it is pink. Rather to use the pink salt than the white salt. I would like the doctor to answer. I don't know the name, but it have it by which it's a very expensive salt. But if you have to get it from overseas, it will be more cheaper. So I want to ask it. It's better to use the pink salt than the white salt.
Okay.
Thank you.
Thank you, caller.
Right. Yes. Generally, it's based on research. Its salt content is a bit less. Let's start with that. Also, it helps in reducing inflammation and a few other stuff as well. So yes, it is considered a more healthy or health considered option as compared to the regular sea salt or whatever salt option that we normally use.
Yeah. So the pink, the Himalayan salt. I saw the Celtic salt the previous caller had spoken about. Is a sea salt.
Okay.
And it's felt to be lower sodium content, just like the Himalayan salt is lower salt content as well. But it's still salt.
It's still
Salt.
type of
It's
salt.
still a type of salt. Yes, Jacinta.
So I know our time is very limited, but quickly, doctor, and I'm sure you've had that question posed at you many times. Baby aspirin. We've had customers coming in picking up baby aspirin from the shelf without any consultation, because they figure they're of age. And it's time to start
Taking a
taking
baby
baby
aspirin.
aspirin every night, as it's a blood thinner and to prevent blood clots. So I want you to just briefly educate our listening audience as to when is it most appropriate, or is it inevitable that when you reach a certain age, based on your cardiovascular health status, that you should start baby aspirin?
Okay. All right. Aspirin. Aspirin, as we know, is a blood thinner. All right. One of our pillars of our treatment for ischemic heart disease and any ischemic conditions, whether it's ischemic cerebral disease or kidney disease. Right. Now there are indications. Like every medication, there are indications. Prior, we're talking some 15, 20 years back, aspirin was considered a mainstay of our treatment for hypertension, which no longer is. No longer is. Everybody that you saw 15, 20 years ago and the hypertensive, they had aspirin as one of the treatment options. Okay, which is not the case in today's time. The only indication for patients with hypertension where aspirin is considered an option is once they're hypertensive and they're also diabetic. Or the person has a ischemic heart condition. When I say ischemic heart condition, they've had a heart attack or a milder version of a heart attack, which is considered angina, or they have a history of an ischemic stroke or kidney disease. So the conditions are: aspirin is beneficial to our hypertensive patients if they are associated, if they have comorbidities of ischemic heart disease, strokes, peripheral artery disease, and kidney disease. No longer, again, it has been already proven over the last 10 years that aspirin offers absolutely no benefit in our patients who do not have those associated conditions.
All right. Thank you very much.
Yes, yes. So we get the
Thank you.
current information
Mm.
now, because sometimes our information is dated.
Yes.
So I like that. Dr. If it is already 11:53 a.m. and we are sadly, at the end of our time. But I just wanted, as we wrap up the show here today, for you to tell the listening audience, they've been very glued into this show this morning. Doctor, I wanted you to let them know, your plans moving forward here in Dominica, and just where can they link with you, and when should somebody see a cardiologist? That's the last thing I wanted to ask. When should I be seeking out Dr. Reef? When? For what?
Again, when I embarked on my studies, the initial at that moment there was no cardiologist in Dominica.
Mhm.
I think Dr. Andrew, which is
Yes.
the cardiologist there,
Mhm.
she came back the very year I started. All right.
Okay.
And I saw a need for it at the hospital because I think it's one of the more common conditions, always hypertension, diabetes, ischemic heart disease, and I felt like it was something very needed at that time. Moving forward, my idea was to do cardiology and then later do interventional cardiology, which is stenting, valve replacement, and those kind of stuff, to at least be able to offer our nationals those options here in Dominica as opposed to going to Martinique and Guadeloupe and Barbados and Trinidad, which aren't options for people who cannot finance their own trip to those countries. So the idea is to take the levels of at least cardiology care in Dominica and across the Caribbean, if things does progress and extend, to that where people can consider Dominica a place where they can come to get medical tourism and offer all the options. As to reasons why you need to see a cardiologist, hypertension is not one of our reasons to see a cardiologist, I must say.
Okay.
Hypertension, the heart is just one of the, like any organ, one of the organs that receive repercussion as secondary to the hypertension. The people who more have to see it, who should be seeing hypertension are our general practitioners, our nephrologists, because nephrology, there are nephrologic conditions which are way more prevalent than our cardiogenic conditions, right? And our endocrinologic conditions, which are way more prevalent than our cardiogenic, right? The reason to see a cardiologist, you've been experiencing palpitations, which is a feeling of your heart just beating out of your chest. Chest pain, which is described as I previously mentioned, or a sharp chest pain that is spreading towards your back between your both scapulas. When I say your scapulas, I mean the shoulder blades, right? If you had a history of a DVT, I know you're now experiencing, you probably think that you have a second one, and you're experiencing again the shortness of breath, the chest pain secondary to that, or you're having chest pain or shortness of breath once you walk in certain distances, as opposed to 2 months, 3 months back where you could walk relatively normal. So again, a decrease in your body's function when it comes to be able to tolerate exercise is indication for you to see a doctor. It could be a case where you're experiencing heart failure for X and Y reason, and our objective at the hospital is to explore why exactly that you are experiencing such a decline in your body's function. And we must explore the cardiogenic causes of that, heart failure being one of the most common of those. As to where to find me, the Dominica China Friendship Hospital in a few months. And the intention here is to really raise the standards at the hospital if the board does permit and the hospital does permit.
Amen.
Nice. Jacinta said amen. All right. So there you have it. We've come to the end of our time. We even passed our time. But of course, thank you as always to our listeners for, giving us your ear on Health Vibes, and of course for those who called in and chimed in. It was good to have you be a part of the program. So So, God willing, we will be back again next week with another episode of Health Vibes. But I do want to wish all our listeners, of course, a great rest of the day and rest of the week until we join you again next week, Wednesday. And of course, thank you to Dr. Reef for being a very willing and very, as the caller said, down to earth and keeping it real guest this morning here on Health Vibes. Thank you so much, Dr. Reef. And until next time, we're signing out from the program. Good day.
Take care.
All right, take care.
Who said health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website. www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare. In healthcare.
Just received at ESA Trading Limited a wide range of disposable diapers. Your very favorite, world class. Giggles Babies diapers, specifically designed for your baby's comfort. With stretchable elastic sides, cloth-like backing, super absorbent, and super strong. Available regular or pull-ups in small, medium, large, extra large,